Hello, everyone, and welcome back to Health Matters. I'm Alpesh Parmar, and I'm glad you have joined me for our second episode. And from the second episode itself, I want to talk about a disease which I have closely seen, and it's very close to my heart: diabetes. About 15 years ago, my parents were diagnosed with diabetes. Witnessing their struggles firsthand opened my eyes to the realities of this condition. I started noticing after that almost, I would say, 2 out of 10 people over the age of 50 started mentioning having diabetes. Later on, I discovered that my in-laws were also diagnosed with diabetes. That was very recent, about um, between in last 5 6 years. So this personal connection compelled me to learn more. I began reading books specifically focused on diabetes at first, including um, the China study by T. Colin Campbell and Thomas M. Campbell too. And that was not about diabetes, but it had mention of diabetes. And that was my very first book I started reading about diseases and how nutrition affects our body, our lifestyle, etc. And then once I started digging deeper into diabetes, I bought a book called Dr. Neil Bernard's Program for Reversing Diabetes. I bought another book called Mastering Diabetes by Cyrus Kambata and Robbie Barbaro. The End of Diabetes by Dr. Joel Furman, and How Not to Die by Dr. Michael Greger, actually. And these books, among others, I'm just highlighting these books because they opened my eyes, but I read many more, and they all had something to share. But all of this book emphasized how diabetes and similar conditions are lifestyle diseases affecting many, especially in affluent societies. So it's not only, I would say, a lifestyle disease, but it's called disease of affluence for a reason. In 2021, I received my own wake-up call. I was diagnosed with pre-diabetes. And by that time, I had turned vegan in 2017, wanting to help the planet, help environment, help um, basically stay away from animal abuse. And I thought I was eating healthy, but no, I was still eating a lot of processed food, a lot of junk food, and we'll talk about that in next episodes. Determined not to let it progress, I decided to take matters into my own hands. I didn't want to start taking medications like metformin and potentially deal with various side effects. And we'll discuss these medications, their pros and cons in future episodes. And but remember, I'm not a doctor. You should consult your doctor. And if medication is needed, if insulin is needed, you must take it right away. But start making changes, lifestyle changes. So I want to remind everyone again, like the first episode, I'm not a doctor, scientist, or a certified expert. I'm simply sharing what I have learned after reading numerous books, attending seminars, and applying this knowledge to myself and my loved ones. Always consult healthcare professionals for medical advice tailored to a situation. So, what is diabetes? Diabetes is a chronic health condition that affects how your body turns food into energy, right? When we eat, um, that food gets turned into energy, and that's how we function. That is fuel for our body. When we eat, our body breaks down carbohydrates into glucose or sugar, we call it, which enters the bloodstream. The pancreas then releases insulin, a hormone that helps glucose get into the cells to be used for energy. So basically, the glucose gets released into the bloodstream, right? And then now pancreas realizes glucose is there, so it releases insulin, and now insulin will take that glucose or sugar into our cells, right? And once that goes into our cells, we can use that blood sugar or glucose as energy. So in diabetes, there are basically two types, and actually three types, but we'll start with two. That is type 1 diabetes. The body doesn't even produce insulin, right? And that is why it's called autoimmune disease, because the immune system attacks and destroys the insulin producing beta cells in the pancreas. And type 2 diabetes, type 1 diabetes, I think there are, again, I could be wrong, but there are, and I don't want to compare how many, but there are less cases of diabetes, type 1 versus type 2. Of course, type 2 is totally lifestyle disease. In type 2 diabetes, the body doesn't use insulin properly and may not produce enough insulin. And so that is what it's called insulin resistance. And we'll talk about that in next episode, most probably. When insulin isn't working correctly, glucose stays in the bloodstream, leading to a higher blood sugar levels. Over time, higher blood sugar level can cause issues, right? Basically, that blood sugar level can create other serious health issues. There is also another, as I mentioned, third type of diabetes. It's called type 1.5. So it's right in the middle, type 1 and type 2, and there is 1.5. And it's also called LADA, latent autoimmune disease in adults, or diabetes in adults, sorry. Latent autoimmune diabetes in adults, LADA. And the reason is usually the type 1 diabetes starts with kids, right? So in younger age, when you are over 50, it's type 2 diabetes usually. I would say, again, I could be wrong in some of those theses, so better check with your doctor. And then type 1 usually starts before you are 30, or even in your less than 20 years old. So, but that 1.5 is LADA shares characteristics of both type 1 and type 2 diabetes. And it's an autoimmune condition like type 1, but develops in adulthood and progresses more slowly. And that's why it's called LADA. So you might be wondering how diabetes and pre-diabetes are diagnosed. Here are some general guidelines. Again, always talk to your doctor. Fasting blood sugar, or FBS, is either 126 milligram or higher, and sometimes some countries they use MMOL as the calculator. Then it's 7.0 mmol or higher. Blood sugar 2 hours after eating, all it's called postprandial glucose. That is if it's over 200 milligram per deciliter, or 11.1 mmol or higher. Or HbA1c 6.5% on higher, that is hemoglobin A1c, and that basically measures your 3 months average of blood sugar in your body. And if you're consistently following, you may be diagnosed with pre-diabetes, which is FBS, fasting blood sugar between 100 and 125 milligram per deciliter. Blood sugar 2 hours after eating between 140 and 299. Again, this measurement could be different. Some doctors will say 140 to 180. Hemoglobin A1c, HbA1c between 5.7% and 6.4%. Again, these numbers are based on guidelines from organizations like the American Diabetes Association. It's important to get tested if you suspect you might be at risk. And we'll talk about that also in future episodes. Global prevalence of diabetes. Let's look at some staggering numbers to understand the scale of this issue. Worldwide, as of 2021, approximately 537 million adults, which are between 20 to 79 years old, are living with diabetes globally. This number is projected to rise to 643 million by 2030 and 783 million by 2045. In US, and of course I'm based out in US, so I'm going to talk about US, about 34.2 million people have diabetes. That's 10.5% of the US population. And I'm going to, of course, also always mention the most populated country in the world, as well as, my home country, India. India has one of the highest numbers of diabetes patients. Approximately 77 million adults have diabetes. And this number is expected to double by 2045. And we are talking about these cases where they already know. Now let's talk about undiagnosed cases. right? A significant concern is number of people who are unaware they have diabetes or pre-diabetes because they never get their blood work done, or they think they are healthy like me. I was always, yeah, I'm good. I work out. I go to the gym. I think I eat healthy. I plan my meals. I look at my calories, etc. But that's not enough. So worldwide, nearly 50% of people are living with diabetes. With diabetes are undiagnosed, right? So the numbers I gave you, maybe it's double than that. In US, about 7.3 million adults, 21% of those with diabetes are undiagnosed. Approximately in India, approximately 57% diabetes cases are undiagnosed. So the people don't know they have diabetes or pre-diabetes. Diabetes can lead to a range of health issues. Cardiovascular diseases, right, increase the risk of heart attacks and strokes. Neuropathy, nerve damage causing pain, tingling or numbness, especially in the limbs. Nephropathy, kidney damage that can lead to kidney failure. Retinopathy, eye damage that can cause vision loss or blindness. Food problems. Poor circulation can lead to ulcers and infections, sometimes requiring amputation. Skin conditions, higher susceptibility to bacterial and fungal infections. Hearing impairment, increased risk of hearing problems. Alzheimer's disease, type 2 diabetes may increase the risk of dementia and Alzheimer's. These complications can severely impact quality of life and can be life-threatening. Many books and experts refer to diabetes as a lifestyle disease, as I mentioned before. This means that it's largely influenced by our daily habits, including diet, high intake of processed, ultra-processed foods, sugar, and unhealthy fats, physical inactivity, which is also very common, sedentary lifestyle contributes to obesity and insulin resistance, stress. Chronic stress can affect blood sugar level. I think that was one of my issue. I was always stressed out about business, about what I should do, etc. Because I was trying to do everything else, but I was not managing my stress. And we'll talk about how to do that as well. Smoking and alcohol, both can increase the risk of developing diabetes. The good thing is I've never smoked or had alcohol, so at least I'm out of that. Upon learning I had pre-diabetes, I decided to make even more significant lifestyle changes. Dietary changes, I shifted to a diet rich in whole foods, fruits, vegetables, whole grains, legumes, nuts, and seeds. I reduced or pretty much almost eliminated my intake of processed foods and sugars. Sugar, not complex carbohydrates. I continue to eat complex carbohydrate. I'm talking about simple carbohydrates, which are sugar, white flour, white rice, etc. Regular exercise, which I was already doing, incorporating both aerobic and resistance training. Education, which I love to educate myself, continuously learning about health and nutrition to make informed decisions. Pros and cons of medications like metformin are very difficult, right? They can, because of course it can manage diabetes, but it can also have side effects like gastrointestinal issues, vitamin B12 deficiency, which is already very common in vegetarian and vegan. And now because of metformin, it would reduce the absorption of these vital nutrients. Kidney function impact, caution is advised for those with kidney issues. So, in conclusion, I want to say that diabetes is a global epidemic affecting millions. Understanding diabetes, its types, including type 1, 2, and LADA, diagnostic criteria, and the complications it can cause is crucial. By recognizing that diabetes is often influenced by lifestyle, we can take proactive steps to prevent or manage it. In the upcoming episode, we'll explore again type of diabetes, deeper dive into 1, 2, and type 1.5, risk factors, genetic and environmental factors, including diabetes, preventive measures, how diet and exercise can reduce risk, in-depth look at some of these medications, and success stories. I think it's very important to, and again, I'm gonna ask some of the people I know who have reversed their diabetes, and I'll ask them if I can take their stories and share them with you, because I see them in my WhatsApp groups, Facebook groups, and I just want to tell people about how these people are successful. Some people have reversed their 20-year-old diabetes, which they have had it for over 20 years, and some of them had A1C, which was over 10.0, and they have brought it down to 5.5, 5.8, etc. And so we'll talk about all that. I encourage you,